And welcome back to Hometown Headlines Radio Edition for this Monday morning. Just gorgeous outside. 61 degrees out there. Humidity a little higher than we like, around 97%. Going to be 86 degrees today, then right back down to 61 degrees. 57 in Cartersville this morning, 1 degree above tying a record over there. Nice weather out there. When the weather does get nice outside, the first sign of fall is headed our way. Folks want to get outside and exercise. May not be a good idea for some patients out there. Here to talk about that and about fall allergies, if Jeff Thompson, Floyd's Director of Respiratory Therapy. Jeff, good morning, sir.
Good morning.
Jeff and I, of course, by the way, are the charter members of the Hair Club for Men. So we'll talk about respiratory, we'll talk about hairlines,
That's
too.
exactly right.
The important things out there in Northwest Georgia. No, Jeff, glad to have you here. I've known Jeff for years, involved. Our kids been involved in all sorts of sports out there, but also in your day job, Jeff, you're out there trying to keep us breathing properly, and here comes one time a year that's really not a good time.
No, it's not. Lots of folks have allergies to the different things that are going to be happening in the fall, and that exacerbates a lot of their other problems, and that's what allergies can do to you. You get, if you have asthma or if you have anything that can trigger issues, allergies come along and trigger those issues for you, causing people to get sick. Not to mention the hot and the cold. The temperature variation tends to do the same thing.
We start to see things die off out there, or even the leaves changing and all. How does all that in nature transcend what's happened to all of us?
Well, just different spores and things get released, which we inhale and our bodies have to handle, and some folks can't handle those spores as well as other folks can handle those spores. So that causes triggers for different diseases. So any disease that you're carrying along with you that may be mitigated by medication or exercise or anything like that can just be triggered and you get sick.
That's not fun stuff at all. I mean, we went through something, went down and saw some friends of ours, some family on Saturday night down in the Smyrna area, and I mean, they're all sick with something or other. And all of it was allergies first. I mean, the head cold, the watering eyes, I mean, the breathing thing, and then led into bad colds or, almost flu-like stuff.
Yeah, and folks can, get sick when they have asthma and these other things. It just exacerbates everything, just makes you even sicker than you were before. My son has asthma, and he just actually finished an episode of where he just gets a little cold comes along, and then it just kind of gets worse. Then his chest is tight, and then we're doing medications and breathing treatments for like a week to get him over that. And that's about how long it takes to get him over, about a week. So, and for people who are immunocompromised, older people, it's even worse. It'll last even longer for them to be able to fight back.
Which is worse, fall or spring?
They're about equal. With the fall, it starts to get really cool and the cool temperatures, and then we have warm days, and so it kind of goes back and forth, and that really breaks down people's immunocompromise, makes them more immunocompromised.
And when that does happen, of course, we're talking about doctor's visits. Now, the hospital itself, I mean, I bet you see your patient, your beds start to fill up a little bit with some people, like I said, either older people or anyone. It can be any age that has any kind of a breathing problem already.
Absolutely. The fall and with the beginning of the cold fills the hospital up, especially pediatrics. We start to see a lot more kids, whereas in the summertime our census drops very low, 1 or 2 children a day on average, where in the fall the pediatric unit can fill up and we have to overflow to other units.
See, I'm surprised, but I thought it would have been more of the older population filling things up. But it's really the kids out there. Any certain age?
Well, the youngest kids. I mean, the youngest kids, especially kids that have congenital issues or ongoing disease processes. It exacerbates all of those things. But we do see the older population as well. Really, as it gets cool in the evenings and cool at night, we start to see a lot of the problems with the folks that can't breathe well. Your asthmatic patients, your COPD patients, patients that are on oxygen at home already, they just tend to get a lot sicker and end up in the hospital. And we tend to fill up at Floyd in the fall and stay full throughout the entire winter.
Wow, I didn't know. I mean, I knew there'd be some of that going on in there. I'll tell you what, I was going to ask you about what you do when you're getting treated in the hospital. Let's reverse that. What can we do day to day to maybe minimize some of this?
Well, I think several things you can do depending on what disease process you have going on. Asthmatics need to avoid their triggers. They need to avoid the things that cause them to have asthma. Sometimes you never know what those things are, but a lot of it occurs in nature. So being out in the woods, being out when these exacerbations are beginning, those are things to avoid. COPD is a disease that is lung destruction, so we have to do things to improve our lung function. Exercise, eat right, eat the right kinds of foods, eat foods that don't produce carbon dioxide. Okay, carbon dioxide retention is a big problem for COPD patients. Go through pulmonary rehab and maximize their living conditions at home. Make sure the house is dust-free, clean, and clean it regularly. Maybe not leave the windows open as much as you'd like to, even though the weather's so nice, but that just can introduce those things that are going to cause issues down the road. So you have to take care of yourself even better and pay attention to all those things so that you don't get sick.
You talk about exercise, of course. I can hear somebody saying, well, gee, I can't go exercise because I got this kind of stuff. Better indoor or outdoor exercise?
Well, I would say indoor. In our pulmonary rehab program, we have found that patients that can't even walk to the mailbox, if they do exercise, even if it's for 2 minutes one day, 3 minutes the next day, they build endurance and they can actually improve their activities of daily living. Then they can go to the mailbox. Better for them to exercise inside, yes. The temperature's controlled, everything's controlled, and that's where we exercise these types of patients.
The climate's controlled, and there's enough facilities around here. I mean, the Y, of course,
that's
Cage
right.
Center, other things around here to help that come around a little bit. But it's funny, people, like you said, it's nice weather outside. I mean, I tell you, getting up this morning, getting my AJC out of the driveway, walk down, and boy, it's be a great time. I try to do a walk every day. What a great time for a walk right now. Well, time-wise, it's not going to happen. But that urge to get outdoors with the great temperatures, kind of fight that, huh?
Sometimes they have to, or take antihistamines or things prior to doing that. Plan it better, make sure that you've taken care of yourself versus just going outside. That's what patients that's what people that are living patients have to do. If you have a disease process that's ongoing, you have to pay attention to those types of things versus people who are perfectly healthy that don't.
Say you're a young parent, a new parent, and you're starting to see a child come down with some things you have suspicious. What warning signs should they look for this?
Well, I think the first thing is nasal congestion. That's the first trigger. If your nose is secreting fluid, you have to assume your lung is secreting extra fluid too. That is secreting that fluid to try to trap the spores that you've inhaled when you breathe in, so the things that are hanging up in the air. So as soon as that begins, the body has begun to fight to get rid of whatever you have inhaled. So as soon as you start seeing those symptoms, lots of water, ingest lots of water to keep those fluids thin so they don't clog up and cause all the congestion that you get. You want it to flow freely. That's the body's natural mechanism to handle those types of things. So and antihistamine may be the next step if you start to see things.
At what level, when all this is going on, is there a level the parent should say this is something we need to control with the doctors? Is there a kind of a threshold they should look for?
I think fever. I think if you start getting fever, then we have an active infection and the body's trying to fight it. So a fever that can't be controlled with simple Tylenol is probably the time to see the physician.
All right, good stuff there. Talking to Jeff Thompson, Floyd's Director of Respiratory Therapy. Let's talk a little bit more about COPD, what it is, what it means, and what we can do about it.
Well, COPD is a chronic obstructive pulmonary disorder, and it's a disease characterized by several diseases, and actually it's a broad term for very impaired lung function or lung destruction. A lot of it is caused by cigarette smoking. A lot of it is caused by air pollution. Maybe the industry you worked in didn't have the best ventilation. We didn't understand those things back in the 70s and the early 80s about what air pollution and things inside of plants did to our lungs. And it's permanent destruction of lungs. So those lungs are not going to get better. So these patients tend to be very sensitive to temperature changes, very sensitive to allergens or pollens in the air that can really cause them to have problems. These are the folks you see in the mall with oxygen on. They're sick folks, and the best things we can do for them are to rehabilitate them, try to improve their activities of daily living. Those are the type of folks can't walk their dog, can't walk to the mailbox, and they want to, and that's kind of sometimes their goal. So Medicare actually is starting to move in the direction of preventative medicine. Pulmonary rehabilitation is preventative medicine. They recognize that if you put these folks into a rehabilitation program where they learn exercise, diet, and things to avoid, like the triggers that make them sick, you can actually decrease their hospital admissions, which cuts Medicare's costs. So it was smart medicine to do it. And the research showed that it works. At Floyd, we have a pulmonary rehab program that is very popular for these COPD patients, and they get 36 visits where we set levels for them to achieve and like walk so far on a treadmill or use an arm ergometer, and these folks achieve it, and they walk out of there better than before. One of the best stories I heard was a fella hadn't been able to get up to his neighbor's house because it was up a hill for 5 years, and he came through pulmonary rehab and he was able to walk to the up to his neighbor's house, and he was so excited about that, and that was a big surprise for the staff when he told us that story and how much better his life had improved. You can't fix COPD, but you can certainly make it a lot better with it.
And you can learn to live with it, and you can learn to rehab it. And
Absolutely.
like I said, weight and exercise, that's going to be one of the big things. A lot of folks don't realize how the lungs are tied in with your whole circulatory system, and that when your lungs start to go, then you start to get heart damage as well.
Absolutely, because the blood comes from the heart into the lungs, picks up oxygen, and back to the heart where it's pumped out through the body. So they're integral together. That's why when they're transplanted, sometimes they're transplanted together. Heart and lung transplants are very popular. And lung transplants are becoming more popular. Folks that are going to get a lung transplant, usually down at Emory, have to go through pulmonary rehab before they will even do the lung transplant.
I'll be darned. You're going to get the muscles.
That's right. Maximize those patients and teach them exercise habits that they'll continue to do after their lung transplant. That's
amazing. A lot of this, you don't realize how widespread this is, how much research going on. But I love to hear it's getting more proactive than reactive.
Absolutely, and that's the best thing I think about Medicare recognizing that pulmonary rehab does work. It is preventative medicine, which is where we got to go.
Great idea, and I love how the combination, the weight loss, exercise, all that stuff, that works out great. Jeff's got about a minute or so left. People want more information on what you guys do. What can they do?
They can give us a call. It is 706-509-3590, or tell their primary care practitioner. He knows how to refer them to pulmonary rehab. Just tell their doctor that they're interested in rehabbing themselves. A lot of folks are scared of this because they're on oxygen. Don't think they can go on a treadmill, but they can, and we've proven that they can. So contact their primary care provider, and he can refer them over to a pulmonary rehab program, and we'll take a look at them.
Well, that's a great idea. I love that success story, especially the gentleman who would be able to walk up. You take that for granted sometimes about how you can't do those things. Nice to see that's out there. And one more time for people who have any children who are coming up and they may see some red flags. Again, what are those red flags to watch for?
Fever, uncontrolled fever. If you can't get a child's fever down, then you probably need to see the physician.
All that stuff's out there right now. We're entering that big fall season. Nice to know, though, that at least it's an equal opportunity. It's not just fall and spring. It's just both of those things are kind of bad. Jeff, I want to thank you for your time today coming in and talking about that. Again, you want more information, as Jeff said, call that number or go to floyd.org and go right through it. Just see all the information there and on Facebook as well. Jeff, thanks for your time today.